Hi, my name is Shafiq Shahrin, and today I'll talk to you guys about what an ACL injury is. To start off, we need to know the difference between ligament and tendon. So, a ligament is a fibrous connective tissue which connects bone to bone and holds the structure together to keep them stable. This differs to tendon, where it is a fibrous connective tissue which attaches to muscle to bone. So, an example of ligament is your ACL, anterior cruciate ligament, which is located in your knee, and an example of a tendon is your calcaneus, which is your Achilles tendon. So, how does the ligament and tendon work? Well, between the femur and tibia, there are actually four ligaments holding them together, and helping the tibial femoral to not move out of place. And the four are medial collateral ligament, which is your MCL that runs along the inside of your knee, hence medial, close to your middle line body, prevents the tibial femoral from sliding within the frontal plane towards the midline. Lateral collateral ligament that runs along the outside of the knees, hence lateral, further away from your midline, prevents the tibial femoral from sliding within the frontal plane away from the midline of the body. Secondly, anterior cruciate ligament, which is the ACL, located within the middle of the tibial femoral, that prevents the tibia from sliding out within the sagittal plane, and posterior cruciate ligament, PCL, which works with the ACL by stopping the tibia from sliding backwards within the sagittal plane. And these are the knee. That's a good example here. So next up, the occurrence of the injury, how the injury has been distinguished. So there are many ways of how the injuries can appear, one of which is either by contact or non-contact. For example, non-contact injuries would have an athlete rapidly decelerates followed by a sharp or sudden change in direction. And the contact injuries most commonly occur after a blow out to outside of your leg, causing ligaments to overstretch, thus resulting in a tear. You'll understand more once I've shown you this video. Well, there you have it, a video of contact and non-contact ACL injuries. So there are different grades of the severity of injury. Grade 1, which is a small number of fibers are torn, resulting in some pain of the joint. The function of the knee will stay normal. Grade 2 tear, a large number of fibers are torn and the knee joint will lose a lot of its functionality. And last but not least, grade 3, the ACL ligament is completely torn and knee is not stable. Your grade 3 injuries usually last from 6 to 9 months, whereas the others last within 3 or 6 months. The statistics of injury. So the general statistics of ACL within the US shows that on average, around 150,000 people suffer from an ACL injury, and that is about 500 million worth of health care each year. More so, to give you guys an example of how intensity of the sports are required from athletes. As you can see, there are common trends here. Women are more prone to ACL injuries in comparison to males are due to a biological trait. Women tend to have bigger pelvises in comparison to males do to accommodate childbirth. Therefore, the alignment and the angles of the femur and the tibia is greater than males are. As a result, when a woman has more tension on her knees than males are. Common injuries found in sport are as follows: basketball, figure skating, football, gymnastics, handball, field hockey, lacrosse, rugby, skiing, soccer, tennis, especially in singles, volleyball, and wrestling. Operations procedure. There are two operations to help the ACL tear. One of which is called autograft. They are using the patient's own tissues, and the most common option include the middle third of the patella tendon and the hamstrings. Secondly, allograft, which is from a tissue bank. Most commonly, allograft tissues are used for ACL reconstructions, and most commonly found as your Achilles tendon. So basically, they replace your Achilles tendon, your ACL with other ligaments in people's body. So this is Shafiq signing off, saying that you should be careful of what sports you do. Just because you love doing sports that you love doing doesn't mean you're invincible. So work hard, train properly, and last of all, have fun.